Hello and welcome to my channel. This is sn1ep9. Thank you for tuning to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel that we usually talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Let's empower ourselves so that we can be able to be responsible of our own health as we all engage. Thank you. Kindly, if you have not yet subscribed to my channel, kindly subscribe. This is Isaac Simple and Real. You can also call me Mkurugenzi Maish. Thank you. Now, in our topic today, we are going to discuss about vaginal candidiasis. Now, someone may ask, now, what is vaginal candidiasis? This is usually rather a non-sexually transmitted but an opportunistic infection that is usually caused by a certain fungus that we call Candida albicans or Candida albicans. Are we together up to that point? Thank you. Now, Candida albicans is a fungus that usually exists on our skin. It also exists in our mouth and in the vagina. Rather, not as a pathogenic fungus, but a normal flora or a fungus that usually do not cause any kind of infection in our body other than just existing on our body. However, in the circumstances like compromised immunity, for example, the likes of HIV infection, chemotherapy, whereby immunity is suppressed, hormonal changes, especially in women during pregnancy, and in some cases during the normal hormonal changes in women, this fungus can flourish or can thrive and increase in numbers to cause infection. Now, what are some of the presentation of candidiasis infection, especially vaginal candidiasis? Now, candidiasis, someone who is suffering from vaginal candidiasis will present with pain while passing urine. They may also present with pain while having sex, vaginal sex. They may also present with vaginal discharge that is usually curd-like and foul-smelling. They may also present with dizziness, lower abdominal pain, and lower back pain. Are we together up to that point? Thank you. Now, let's go further and discuss how to come up with a diagnosis of vaginal candidiasis. Now, someone who is suffering from vaginal candidiasis can be diagnosed clinically with the healthcare worker or the doctor who is examining you with a good history that you offer to the doctor and clinical or physical examination of your genitalia. A doctor can be able to visualize and come up with a diagnosis of vaginal candidiasis. Also, it can be isolated in the laboratory. With microscopy, yeast cells of Candida albicans can be isolated in the laboratory, and which is confirmatory of vaginal candidiasis infection. Are we together up to that point? Thank you. Now, let's go to the treatment. Now, in terms of treatment of vaginal candidiasis, there are very effective antifungal agents that we usually use in the treatment of this kind of fungal infection that we call vaginal candidiasis, and some of which are the likes of the class of azoles, likes of fluconazole, itraconazole. We may also decide to use pessaries like the examples of clotrimazole pessaries, which are very effective in the treatment of vaginal candidiasis. And this comes to the end of our topic today. Kindly, if you have not yet subscribed to my channel, kindly subscribe. Go to the YouTube, type the word Mkurugenzi Maish or Puma Health Solutions. Then subscribe, press notification, like and share. And if you have a comment, kindly drop your comment. Thank you and God bless you. Bye bye.